The base of an overbed table slides underneath the bed, and the top of the bed of the overbed table slides across the patient's bed, or sometimes they will use it next to the patient's bed. The top portion is adjustable, so you can raise it and lower it to whatever seems to be the right position for the care that you're providing. Patients use these overbed tables for a number of reasons: for eating, for maybe writing letters, or can be used for providing care by the caregivers. It's considered a clean area, however, so you would make certain that you never put a bedpan, urinal, or other soiled item on that overbed table. It's also important that you clean the overbed table several times a day to maintain its sanitary condition. The bedside stand provides storage for an individual's personal care equipment. The top drawer usually houses things like can be toothbrush, toothpaste, deodorant, maybe a comb, brush, glasses, personal items that the patient can retrieve rather easily. The lower drawer provides storage for the wash basin, bedpan, and other kinds of equipment. Each unit has what's called standard equipment, and that means that each unit would contain a wash basin, a bedpan, a urinal, and an emesis basin. Also, a water container would always be provided for an individual. Although most people come to a healthcare setting with their own comb, brush, toothpaste, toothbrush, those things are available, if need be, by the healthcare facility. Many facilities have a bathroom in each room. Some of them share a bathroom between two rooms. The toilet, sink, call system, and mirror are standard items in a bathroom. Sometimes you will have a tub and a shower in a bathroom, but that is not always the case. Handrails are always attached to the toilet for safety's sake. Toilets in many facilities are higher than the standard toilet, and that's so that it makes it easier for people who are in a wheelchair to transfer from the wheelchair to the toilet and back. It also makes it easier for people who have severe arthritic joints to get up and down when the toilet has been raised. The call system allows the patient to communicate with others that are there to care for them. The call light that is at the bedside is connected to a call light above the door of each room. It's also connected to the nurse's station. When a patient pushes a button at the bedside, the light goes on over the door, and it also goes on at the nurse's station. Staff members must be alert to the call system turning on and answer that light promptly. The light is turned off by the caregiver when they come back into the patient room to assist. The patient needs to be shown how to use that call system, because it would be something that would be unfamiliar to them prior to this coming into a healthcare facility. An intercom system in many that's available in many facilities allows the nursing team members to communicate with the patient from the nurse's station. It also allows the light to be turned off from the nurse's turned off at the nurse's station. Call lights are also standard equipment in each of the bathrooms. Many facilities furnish patient units with other equipment. It's pretty common that in a patient unit nowadays there would be a television, a radio, a clock, a telephone, and some other items that might be available for their comfort. In addition, in some facilities you will have wall-mounted blood pressure apparatus, suction, oxygen equipment, And you might have what are called nursing care centers in a patient unit. A nursing care center would house many items that it's like a mini nurse's station, in that there would be medications for the patients, many of the sterile and clean supplies that are needed. Maybe even the patient chart is there. So you'll see some variation in the amount of equipment that is in each patient unit. Some guidelines for maintaining a patient's environment. Make sure that the patient can reach the overbed table and the bedside stand so that they're not reaching unnecessarily, stretching their arm out and possibly falling, trying to reach the overbed table that could be housing their telephone. Arrange their personal items as the individual prefers. Keep the call light within reach of the patient at all times. Keep the telephone, TV, and light controls accessible too, so that you as a caregiver are not contacted unnecessarily to help them with those items. Provide needed supplies such as fresh water and facial tissues as they need. Handle equipment carefully to help minimize the noise, and explain unfamiliar sounds to the patient. Empty waste baskets as often as needed to prevent clutter and minimize odor. Respect the patient's belongings. An item may not be important to you, but it could have real significance to a person. Something that comes to mind would be just simply a scrap of paper that's on an overbed table. It might have some important phone numbers for the patient. It might be some questions that they've jotted down that they want to go over with the nurse or physician. So always ask before you discard things like that. Don't throw away any item without the patient's permission. Don't become so concerned with the neatness of the room that you forget the patient's rights and preferences. And finally, don't move furniture and belongings of the individuals. People, particularly with poor eyesight, rely on memory and a sense of feel in order to locate items in this probably strange environment. One final note that I would like to talk to those of you caregivers that will be working in a long-term care facility such as a nursing home. These residents have left their private homes. Each one of them at one point in time lived in a home much as you or I do, or an apartment, and had all sorts of personal treasures around them. Now the person lives in a strange place, probably even has to share a room with someone that is not a relative or a friend of theirs, but in fact a stranger. Leaving one's home is a very difficult decision for these folks to make. Therefore, it's important to make the resident's environment as home-like as possible. Ways that you can do that is encourage family members to bring in personal items that the resident has real attachments to. Framed pictures, things that can be put on the wall, plants, little special knickknacks that have had special significance to the individual. Maybe a footstool that was hand needle pointed by someone, or some other special item. Encourage those things. Remember, this facility is now the individual's home. You and other health care members must keep and must help the person feel safe, secure, and comfortable. A home-like environment goes a long way to help maintain a person's quality of life.